Well, no, this guy actually sat in jail.
Yeah, that's unusual for child support.
I was shocked.
Right, if we can get settled. Mr. Domenici, I believe you are up.
And Mr. Hearing Officer, I'll abandon the podium there if somebody wants to walk up there.
Oh,
I was guarding it just to save my witness, but I think I can leave him alone now.
and if you want to sit by him, that you can do so.
No, I think he can handle it himself.
Okay. Mr. Domenici, you said no questions? Okay, thank you. Ms. Navarrete?
No questions.
Ms. Richards? You and I had no questions. Or Mr. Butsiak? Oh, or Mr. Harris?
No questions. Thank you.
Then Ms. Richards?
I just have one clarifying question. There was a question from the board to you about passing a state law to help address some of these issues. And I'm not sure it was quite tracked. And your response was air quality is kind of a local specific thing. But my question to you is, would it help to have a state environmental justice rule so that like local boards such as this one would have some guidance as to how to incorporate those principles into an air quality rule?
Yes.
And does California have that?
Yes.
Thank you. No questions.
Thank you, Ms. Richards. City EHD is not here. Sleta Pueblo?
No questions from the Pueblo of Isleta.
Thank you. Mr. Willard?
No questions. Thank you.
Captain Nafke?
No questions, sir.
Ms. Semino, I'm going to assume that she doesn't have any questions. Mr. Jantz?
Petitioners have no questions for this witness.
Mr. Paseniak?
No questions, thank you.
Not sure if there's a need for a redirect. Mr. Rose?
I guess I can do it from here. I just was going to ask Mr. Cohen in response to questions about program design, what I qualify as program design. You were asked about how to go about addressing issues. And I think there was some discussion about news sources. Do you have any clarification on how you would address the problem and what you would deal with first in terms of an approach to this?
You mean as opposed to new sources?
Correct.
Well, the existing sources is where I would go.
And is that what your recommendation was in terms of prioritizing approaches to this in response to the board's questions?
Yeah, I think it was.
Thank you. No further questions.
Thank you, Mr. Rose. If there's nothing further from the board, you're excused, Mr. Cohen. Thank you. Thank you very much.
Mr. Hinger, so we have no further witnesses.
Thank you, Mr. Rose. I believe you're up, Mr. Domenici. You've got a number of witnesses. Are you going to present them as a panel or individually, or some individually?
Mr. Hearing Officer and Madam Chair and members, I'm going to present several panels. I'd like to make a short opening. I reserve my opening also. And I'm going to try not to be duplicative of the two openings that we just heard from Mr. Rose and Mr. Mullenberger. I just want to sort of for the record indicate that when this rule, when the petitioners filed this rule, I think out of probably everyone in here, my clients were the first ones to get engaged. And what they did is they went out and they hired Montrose Consulting because Paul Wade from Montrose probably has as much or maybe more experience than Mr. Selambini. So we have an extremely knowledgeable local air permitter who is permits under both the state and county program, understands intimately Part 41, the air dispersion modeling that takes place under that. He has done permits in the Mountain View area, among all other parts of your jurisdiction. We also then added to our team sort of a senior person for Paul, who brought a broader perspective. His name is Carl Laney. He's from California, so he's very familiar with a program in a state that is probably ahead of New Mexico. They have a state statute dealing with air quality and environmental justice. They have their regional programs. He's operated in several of those programs. He's been involved in the rural development and application of those programs. And then most recently, as we got close to hearing and we understood that particularly the EJ side of this probably required true toxicology expertise, we brought on Tammy McMullen. She is the only actual PhD toxicologist that you're going to hear from that I'm aware of. There may be one from UNM, but unlike Dr. Clark, she's actually trained and has a PhD in toxicology. She was the state toxicologist for the Colorado Department of Health and Environment. So she's been on the regulator side. She's been in the private sector and has experience in several states. She is extremely familiar with the use of the EJ tools, the screening methodologies, and I think it's fair to say she's extremely concerned over the testimony of Dr. Clark. We did not bring her in to, and none of our experts were brought in to specifically contradict this bill or this rule. We actually have a red line that we presented from the very start. It was our objective to try to present something in the form of alternate language or an alternate rule. I want to let you know that that has been enormously challenging and enormously expensive, because the definition of overburdened community has changed continuously. And so much of the preliminary work that my witnesses did really was, I don't want to say wasted, but really had to be more or less restructured rapidly when we got version 6. So we received that. That was filed about October 6th. It was distributed within a few days, and all of our comments were due November 17th. So with this team that we compiled to try to really be a meaningful participant in this process, really had only 4 weeks to deal with the rule that you all are now grappling with because of those changes. And we may seem like whiners, I hope we don't, but we've tried to point out some of these difficulties that we had a team on board, but the rule has kept changing. And notwithstanding that, we've cobbled together something we think at least provides some guidance and really highlights some of the inadequacies of the proposed rule, and tries to reserve some of the parts that probably could be useful. We have a bunch of yellow line, which is not necessarily typical in a red line. The yellow in that, if we get to it, is really areas that we wanted to get the input from the city on. So we're not the regulator. We don't implement this. Paul works with the regulators. Our other experts work with other regulators. So with certain of this, we felt comfortable redlining. A lot of it, we think and continue to think it really should be the city that weighs in on that. Part of what we relied on in preparing our document was the city's filing, which was their principles that they set forth, where what they thought should be some guiding principles. They didn't propose a red line or a draft. When my client group meets, we have 4 named parties. I have 10 clients. We have about 40 people that participate in our meetings and try to engage and understand what is being proposed. That has been enormously challenging. this rule has, with our first cut at this rule, just to be totally candid, was the petitioners have identified that Part 41, which governs all of their permits, does not really have a HAPS provision. It has a little bit about HAPS. You have to do some measurements, and there is one criteria for denial based on HAPS. But so we saw this, the first version, and said the petitioners are concerned that we have a permitting regime. We feel and continue to feel it's very robust with respect to criteria pollutants. It has a very effective modeling technique that does a cumulative impact using the source methodology you heard very well described. That using that base monitor number, not the associated sources, but the base set actually does set different parts of the city in different categories, because they starting with a higher baseline in the Mountain View area than they might be other parts. And there's a much smaller margin for new permits. And then they model sources. So if there's existing sources, that margin gets even further decreased. So there is a fairly robust criteria pollutant system in place. I think it has successfully, if you want to view it that way, successfully move some of the burden out of Mountain View, because that cushion is not enough for certain facilities. There's simply not enough emissions availability for those types of facilities to deem it feasible to locate there. And so they are not locating there. And they're looking at other places. Then, so we looked at the HAPS world. The state does have a HAPS rule. Paul Wade is very familiar with it, as I think is Trinity, because they permit both in the county as well as the state. So we're going to give you a little more description of how that rule actually applies, and what it might do if it were used here, at least as perhaps an interim step or something to deal with the HAPS concerns. And there's other guidances for HAPS that are standard. And we certainly suggest simplicity and standard, utilizing standard proven techniques. This rule creates an entirely new air dispersion set of requirements. It talks about fence line monitoring, continuous monitoring, unmitigated sources, instead of just saying California has a health, both a cancer risk and a health index methodology, which uses standard permit dispersion modeling. We've added all of these additional items which possibly are based on the environmental justice concern, but they really don't assist in the HAPS analysis. They complicate it greatly. They make it much more expensive, much more time consuming, and probably infeasible, frankly, and impractical. So when we look at HAPS, we want to rely on simple, proven techniques, starting with what the state uses, and then looking at what other states or other jurisdictions in other states use. On the environmental justice side, we have extremely strong concerns with the methodology and the determinations that have been presented by the petitioner through what we frankly feel is a very skilled air dispersion modeler, Dr. Clark, who does not understand environmental justice rulemaking, does not understand and have experience in drafting rules. And I think that's been a difficulty for all the parties, including the petitioner, that even when we propose changes, and we did propose changes, and I will show you written changes that we proposed and tried to work out the portable source issue as an example. Generally speaking, that's an issue that should have been resolved without having to come to the board. But Mr. Clark has no familiarity with portable sources. We would have had to educate him from the start to the finish, the unintended consequences, the permitting regime that's already in place. We tried to set that meeting up. Mr. Jansen tried to cooperate with me, and really we just ran out of time. But there was certainly an effort to deal with that and not have to bring that before the board and take your time. But the reason I feel we need to do that is we were dealing with someone who doesn't know portable sources, doesn't know rulemaking, and it's very difficult to actually make accommodations. We could have changed the rule while he was looking at it in his testimony. When we pointed out, it was pointed out that he was proposing either 5 years of Met data or 1 year of site data, whichever is the strictest. An obvious concession would be remove the whichever is strictest, then you truly have an or proposition, you have two choices, and you don't go into a rulemaking thinking that or come out of a rulemaking thinking EHD is going to figure that out, because that's not really their job. So that's some of the limitations we've been dealing with. We set forth our proposal for environmental justice. We used the health indicators only. We followed EPA protocol. We have 2 maps using 2 or 3 health criteria. We feel extremely strongly that use of the 50% average in both the screening and the permit denial is completely inappropriate. It's not supported by the evidence, and it will create a completely unworkable rule, and will essentially do what we're concerned with, which is prohibit modifications and new permits in your jurisdiction. So we will be providing, I think, strong testimony about that. The last thing I want to mention is I may represent people that emit, but my clients have names. Bob Cook owns Albuquerque Asphalt. You will see him. He is a real person. He's not a dot on a piece of paper. He's invested a lot of sweat and blood and energy in building that facility that is used all throughout this county. He has longtime employees. He has an enormous investment. You're going to see that from 5 or 6 people. So you will hopefully understand this is not the petitioners, who are individuals and they represent other people in their community, versus the polluters. This is your local business community trying to work with you, with the petitioners, hiring the best experts we could find, and working through a very difficult, in quotes, stakeholder process that is frankly not very robust. And I don't think it's fair for me to point blame on that at anyone. If I were, I would suggest probably a proposed rule floated by the regulatory department would have greatly assisted, but none of us have the capability to require that. You as a board don't. Mr. Jantz's clients don't, my clients don't. So unfortunately, we're dealing with that handicap. And I don't think your rules frankly set up a very good stakeholder process when you get a petitioner filed rule. And you tried to work with that, but you will hear from our witnesses, and you've already heard it. Even just the EJ definition can take months or even multiple years in some places. So with that handicap in mind, and the idea, my last point is, when we were getting ready for this hearing, one of the board members was sort of indicating, I think the stakeholder process will occur during the public hearing. I think the rule writing will occur during the public hearing. And to the extent I was allowed to contribute, I tried to caution about that. I indicated that is the most difficult way to write a rule, is in a hearing through cross-examination of witnesses. And I think you've seen that. You've seen over half of the case now, and we don't really have a good red line that people have reached any kind of agreement on that would provide you all guidance as to what you might want to attach to your statement of reasons as a compromise rule, if that's where you're headed or where you choose to view the evidence. We've tried to produce one, as I said. There's also been mention of the state rule, but we're all dealing with that circumstance. And I just want to assure you, we've tried to come together with our experts, with our clients, with our constituents, and participate meaningfully in this process. Thank you.
Thank you. Before you call your first panel, I just want to clarify with Mr. Mullenberg that you've completed your presentation for your business group. Is that correct?
Yes, Mr. Chair.
Okay. Thank you. Can- All right, if you can just tell me who is comprised of the panel?
Yes. So we have Dr. Tammy McMullen, Carl Laney, and Paul Wade.
All right, Dr. McMillan, Mr. Laney, and Mr. Wade, if you can raise your right hand, please. Do you swear to tell the truth in this proceeding? Even though it's not your right hand. Okay, thank you. And we'll turn on the microphones and hopefully you can share them and speak into them.
So I want to make sure the three of you have enough space there. Two of you will be listening a lot, okay, at any time till we finish our direct testimony. So I'm going to call Dr. Tammy McMillan first. I'm going to ask her to introduce herself to the board and then describe her background and qualifications that she's relying on for her testimony.
All right, thank you. Hello, my name is Dr. Tammy McMullen. I'm currently employed at CTEH. It's an environmental consulting firm where I lead our applied public health practice area. Most of my career, I have done regulatory toxicology with a long history in air quality, risk assessment, and public health. Having most recently held the position of state toxicologist at the Colorado Department of Public Health and Environment prior to becoming a consultant. There, I worked closely with the Air Pollution Control Division on permitting facilities and enacting regulations intended to protect public health under the state's authority. At the state and as a consultant, I have spent years collecting real-world, environmental, and lived experienced community data to qualitatively and quantitatively evaluate community concerns and characterize exposures and potential risks to vulnerable communities near industrial facilities.
Let me interrupt you. Can you describe your toxicology education, please?
Sure. I have a PhD in toxicology and environmental health from Colorado State University. Following my PhD, I worked in industry at Dow Chemical and Dow Corning for about a decade, being a regulatory toxicologist, running toxicology studies that give you these numbers that we're all talking about as thresholds, doing these studies, submitting information to EPA around the health effects of chemicals.
And are you a member of any toxicology associations or have any certifications as a toxicologist?
Yes, I am a full member of the Society of Toxicology, Society of Risk Analysis.
Okay, thank you. And then I'm sorry to interrupt you.
No.
I hope I
that's
didn't
it. Is
take you
that-
off track. Please
Thank
proceed.
you. Okay. I'll just share that. So some of the work.
Excuse me, do we have a docket number for this?
For my,
Mr. Domenici is going to get that for us. Thank you.
I think it's 189.8, but let's have it verified by Mr. Domenici.
I'm sorry, what did you say, sir?
189.8.
Thank you.
and is that my direct or my rebuttal?
That's your direct.
Okay. Okay, thank
She
you.
will be talking about her rebuttal and I'll get that docket number. And by the way, Dr. McMullen, if you want to have charts brought up,
Okay,
please, I think you can maybe speak directly to
okay,
our assistants over there. And they
Okay.
should have it ready.
great. just a little bit more about my background for the board is that I've spent probably the last several years while I was at the State Health Department, along with what I do now as a consultant, collecting data in communities, boots on the ground, doing air monitoring studies, like many of those actually that were discussed by several of the petitioners experts as being critical to understanding what vulnerable communities and all communities may be exposed to. Often the objective of our data collections actually to directly inform regulatory decisions like air permitting rulemaking. I've done that quite a bit along with facility permit hearings. So in addition to also investigating concerns that are often brought up in a qualitative manner by community members as part of kind of meaningful community engagement efforts. I've testified before multiple boards and commissions, pretty much every level of state government in Colorado. We often find that a lot of the local government hearings, county, state, and as my role as a toxicologist and consultant. In fact, just this past summer, what might be pertinent to this hearing is that I provided expert testimony in promulgating additions to our regulation 3, which is our air permitting regulation in Colorado, that was specifically to address the protection of vulnerable communities. That was an outcome of the Environmental Justice Act that was passed in Colorado. And lastly, I currently actually stand as a member of the technical work group at Colorado to support the Air Pollution Control Division for another recently passed bill, House Bill 1244, that pertains to public health protections for toxic air contaminants.
Okay, and could you provide a summary of your direct testimony?
Sure. May I go ahead and just read it for now? Okay, great. Thank you. So based on my review of the proposed rule and the expert justifications for the proposed rule that I've read and then been able to hear over the last few days, primarily those of Dr. Clark's, I'm really gravely concerned that the lack of scientific credibility for these proposed rules and the lack of demonstrated effectiveness of the rule to achieve its stated intended purpose will result in legal challenges that will end up in court. And as such, the goal of protecting your most vulnerable citizens will be lost. Because the board can review my direct and my rebuttals, and I'm happy to talk further about those if you have specific questions, to understand what I consider the multiple scientific flaws related to this rule, and specifically Dr. Clark's justifications for this rule. I'm just going to speak to you right now for 4 different overarching technical pieces of evidence that I want to bring to your attention. So first, it's unlikely that this proposed new rule is going to achieve its intended purpose. It is likely, though, to result in potential multiple unintended public health consequences. I think that a lot of the confusion and the challenges that I've heard over the last several days, especially from many of us that are technical experts testifying, and the challenges that we're facing in being able to provide constructive, specific redlining to this petition's proposed rule without almost a complete rewrite, happens to be, I think, because it's unclear what this objective of this rule is. To me, it appears that this rule is trying to combine almost like 2 separate but interrelated public health concerns: environmental justice and an air toxics act, or exposures and concerns to that. I'm going to explain some of my confusing issues related to the environmental objectives first. So the petitioners state that their objectives of this rule were to ensure air pollution permitting does not discriminate on race, color, or national origin as required by Executive Order 12898 and Title VI of the Civil Rights Act. In fact, I've heard multiple petitioners, experts, and their environmental justice experts state that these social determinants of health and many others are important indicators for identifying potentially overburdened communities. However, the very first screening criteria in this proposed rule, especially in version 4, that defines overburdened community, does not include any social determinants of health. and no indicators of race, color, or national origin. And in version 5 and 6. These race and social determinants of health indicators are readily available on EJ Screen. And so I'm unclear why the very initial screening criteria that initiates this process of this entire supposed environmental justice cumulative impacts rule would not include these critical environmental justice indicators. Another stated purpose of this rule is to improve environmental and health outcomes in overburdened communities. However, this rule will not likely achieve that goal, in my opinion. For example, the rule proposes, and it applies to stationary sources, and you've heard this quite a bit, I think, from many technical experts, and I'll say it again in my point of view. The stationary sources in near communities, this rule that they define it as overburdened, but when I investigated a bit more and looked at some of the actual air data publicly available by EPA shows that these stationary sources contribute a few percent to total cancer and non-cancer risks in Bernalillo County, while the largest contribution of air toxics in the county include in the overburdened census tracts are from background and mobile sources like highway traffic. So here's what I'm saying. As a public health expert, I have concerns that this rule could be enacted and still not move the needle on the greatest risk drivers that you're concerned about of air pollution in your county. I also encourage the board to consider important potential unintended consequences to public health if the rule is passed. Let me give you an example of what I mean by a potential unintended public health consequence. This rule may force sources like hospitals, such as UNM hospitals, out of vulnerable communities or limit the expansion of hospital services in that community. From a public health perspective, that results in eliminating or making it more difficult for community members to access healthcare. In turn, it can drive prevalence of chronic diseases higher in a community. This, coupled with the rule's exclusion of communities of race, color, and national origin, could result in misguided efforts in expending resources on other factors that aren't driving risk or directly addressing the highest concerns of your local community. I'm just going to take it. I have a second main concern related to the environmental justice portion of this rule. There's just no justifications for many of the criteria in this proposed overburdened community definition that are referenced. There's a really lack of technical documentation. So for example, there's no technical supporting documents for selections of your 50th percentile, 1 mile radius, selection of inclusion of some health indicators while excluding others like cancer prevalence, yet required to do a cancer risk assessment. Methods for converting the EJ screening data that are readily available from EPA in their EJ screening tool, yet they have to be supposedly extracted out, reconverted, transformed to get county percentiles, with no justification as to why that actually brings any better data set than what EJ Screen has. The overburdened community definition and the appropriate indicators needs to be determined by the department who has access to more granular socioeconomic and health diagnostic data like cancer registries, hospital records, to really make more accurate determinations. Currently, this proposed regulation is just simply too ambiguous for the regulated community to implement and define overburdened communities. I actually agree with one of Dr. Morello-Frosch's statements that it is critical to use validated data that have been ground truth for EJ decision-making. And I believe that this current rule lacks this validated ground truth technical guidance. There's a lack of specific guidance on how to obtain and analyze the data for determining these indicators. For example, the rule says use EJ Screen, and Dr. Bilsbeck also said use CDC Places data, and those were used. When I review those specific indicator descriptions in the rule with the indicators that are listed in the rule, you will see that only about half of what is written in the rule can actually be directly extracted from these screening tools in the form and the manner that is written in them. And that is just about one example of the ambiguity and inconsistencies that I have found. Another example is the data source that Clark alluded to in his testimony, which is called the New Mexico's Indicator-Based Information System, or IBIS, and that was talked about yesterday by Ms. Richards. That only provides asthma prevalence among children at the county level. So it doesn't have census tract data, yet it's required by this rule. This estimate comes from a national telephone-based survey, just to give you a little bit of an example of what we mean by the differences in the type of data that should be used for rulemaking. Like I said, this comes from self-reported answers to questions like, have you ever been told by a doctor, nurse, or other health professional that your child has asthma? Have you ever been told, does the child still have asthma? It's not prevalence data, it's not medical provided diagnostic data, nor does it represent a diagnosed asthma exacerbation from disease registries or hospital discharge data. Also, it's not publicly available for census tracts or census blocks, as many times this will violate HIPAA. The data is not only inaccessible, but it's not the same level of objectivity. I'm not saying that that data is not useful. I think it's really important to pull that type of data in when you're trying to understand the community profiles. Just saying that for a screening tool and what was been told to you at the board, that this is simple to pool and that it's all equal, needs to be really thoughtfully vetted. So my third concern is that this petition has proposed thresholds. I'm going to get more specific into toxicology here. The thresholds as their basis for denial of an air permit are really scientifically unfounded, and they're very inconsistent with the definitions of these thresholds and how they're intended to be used by EPA and state agencies in managing risk decisions. These proposed rules do not follow EPA's Office of Air Quality Planning and Standards recommendations for how to conduct an air toxics risk assessment. So why do I bring this office up? Because this office is within the Office of Air and Radiation at EPA, and that is the office that regulates under the authority of the Clean Air Act. And I would consider them to be the gold standard of following their risk assessment procedures. Dr. Clark's recommendation to use RAGs, or risk assessment guidance document, is intended for Superfund sites, while there is a manual with 3 volumes and thousands of pages available with very clear criteria that EPA recommends. While this rule purports to use data from this office, for example, the cancer risk or the hazard index, which are actually being used as a threshold for permit denial, comes from this same office, the rule fails to actually follow the technical guidance outlined by that office. So let me get just specific in what I mean by this. So first of all, the proposed rule recommends screening thresholds for acute exposure scenarios. Those thresholds that are listed at the back of that rule, they're called regional screening levels that come from EPA's Superfund site, are simply the wrong ones you use. You don't use chronic or subchronic levels and exposures for acute scenarios. Those values are provided in the rule. They're meant for longer term exposures, and they're inconsistent with what EPA recommends. And I've actually provided that in my exhibit, specifically what EPA recommends in a snapshot from their website. Second, the rule requires modeling unmitigated emissions and then comparing that and evaluating long-term cancer risk estimates. Unmitigated emission scenarios where there would be no controls for a lifetime of a person's exposure. And what we mean by that is that's assuming 70 years of continuous exposure, someone's standing outside 24 hours a day, 7 days a week for a lifetime, and considering that an unmitigated emissions scenario is real. I want you to think about that. It would not be plausible exposure situation in any circumstance that I've ever done risk assessment in. And by the way, CTH, what we do is emergency response as part of our primary work. And even under a condition like that, an emergency, you would never run those kind of scenarios. It simply makes no sense. Third, This rule requires a permit denial if unmitigated modeling shows that the estimated concentrations are above a mean or median cancer risk or respiratory hazard index number that's for the county. So let me explain why that makes no sense. EPA explicitly says those indicators, which come from EJ's screening tool, and I'll show you in a little bit what I'm looking at, are derived from preliminary screening models. They're not reliable indicators of actual air quality data or potential health risks at a local level. They explicitly say the indicators should not be used in regulatory decision-making. I provided that also as an exhibit straight from their website. And why is it? It's because those data are meant to give a snapshot of the air quality in very large geographic areas, like regional or national trends. They're not detailed specific data. EPA says data sets like this are used to prioritize and take a deeper dive for collecting more specific data. There's nothing in this that says they deny it should be used for denial of a permit. And in my experience, I have not seen a single risk assessment or read any risk assessment guidance documents that use that factor as a comparison for a threshold. Fourth, the second criteria that proposed in this rule to deny a permit is 5 in 1 million cancer risk level or respiratory hazard index of 1. I want to give you a clear explanation of what I mean by these thresholds so you understand why it's so concerning to me that these would be used as a very specific denial for a permit. So for cancer risk, EPA and other state agencies generally use 100 in a million excess cancer risk is what they call an upper threshold of acceptability. And then they use the term with an, quote, adequate margin of safety to protect from public health effects. So being above a county average of 5 in 1 million cancer risk level or equal to a hazard index does not equate to an adverse health effect. It does not mean that there would be harm when you exceed that. And that's what I've heard for the last several days. And I want to make this clear. The petitioner's experts are wrongly concluding multiple times in multiple of their reports. For example, Dr. Clark says that this exceedance would mean that the applicant's specific expected emissions, I'm quoting him here, will be reasonably anticipated to harm human health in one or more overburdened communities. And I just want to state to you at the board, this is absolutely false. You will not be able to find this in any risk assessment guidance document. That an exceedance of that means that there's harm to human health. Clark further wrongly asserts that this increase will have serious health effects. And I'm just going to pause here because I think this is a real disservice to your community to state things like this when it's not factual. Although US EPA and other agencies must establish thresholds, it's inappropriate to use these values as bright lines. I provided multiple supporting evidence within my documents that I provided. So why is this a consensus of the risk assessment community? I want to give you a very clear example. Would you be able to pull, it would be my appendix C, I believe. It would be at the very end. Let's see. So if you go, it looks like I inadvertently did not continue page numbers in my PDF that it's attached. But if you go to page 17,
Say 189.
I'm sorry. So
Yes.
actually, I'm sorry about this. It's in my rebuttal report.
Oh, okay.
Thank you. Okay, I'm not the expert when it comes to these numbers and exhibits. It's actually in my rebuttal report.
Do you know what number that is, Mr. Domenici, the docket number?
They're trying to pull it up right now.
Thank you.
220. Thank you.
Thank you. All right, can you move to page, let's see, page 17? It'd be the very end of my report, and then I'm going to just scroll you down to. Okay, yeah, keep going. Keep going. Okay, go right. Yes, I'm sorry. Keep going down to figure. I think it actually might be the very last. There you go. That's it. Can you all see that at the board? Do you have that? Okay. I can sort of see it. Okay, I just want to take a little bit of time because it's just been thrown around so much about concerns and health effects and that exceedances of these guideline numbers. Okay, so what I'm intending to show you here is just a quick example. This is one chemical, benzene. Heard a lot about that. It's pretty ubiquitous because it comes from a lot of sources. So what I'm showing you here is the acute health effects of concern with benzene, and then the associated screening levels, or what is called in this rule, like your thresholds. Okay, those numbers, that table that was put in the back of the regional screening levels. Okay, so acute means under a short-term scenario, under this proposed rule, it says that an operator would need to evaluate an acute exposure scenario and run a risk assessment. Okay, so as shown in this figure, the agency values are kind of on the left-hand side, those yellow dots. I put in California EPA's number. I put in both their 8-hour and their 1-hour because this proposed rule talks about both of those. And in fact, to my knowledge, California is the only agency that actually has an 8-hour value for community numbers. And then I've also thrown in the acute value from ATSDR. ATSDR is the Agency for Toxic Substances and Disease Registry. They are part of the CDC. They're the public health arm that deals with the environmental exposures and works collectively with EPA and state governments in public health issues. The reason you don't see an EPA number on here is because EPA does not develop short-term acute values except in emergency situations. And so again, that RSO table that's been provided to you does not have any acute values in it. It requires an acute scenario to be ran. So you can see, though, they're a little bit different, and that's because every agency looks at the science a little differently and adds different protective factors, but they're all, so between 1 to 9. Now move to the right side, and what I'm showing you here is where we know health effects to be observed under acute circumstances with benzene. As you can see at the very right, at 110,000 part per billion, you may have, I can't even read it myself here, so give me a second, since it's kind of far away. I want to make sure. 110,000 part per billion is where it's been noted in scientific studies in the literature for headaches in humans. 60,000 part per billion is where there's some irritation, nasal irritation or in the nose in human studies. And 10,000 part per billion, as I go a little lower, is where in animal studies that we do as toxicologists in the lab, you see some slight changes in red blood cells and other peripheral blood cells in mice in animal studies. Most of those numbers on the very left-hand side that we use as screening levels to be health protective when we're doing risk assessments, like you've heard all day long, take that number of 10,200 part per billion. We apply multiple safety factors to it because of uncertainty, because of differences in variability across people, like we've talked about, potential vulnerabilities, considerations of the way people metabolize a chemical, the way it changes in their body, that type of stuff. And we apply those factors, And as you can see in this situation, almost 1,000 times lower, we come up with a number. That number is intended to be used to guide us for risk management decisions. And then, so that's what I'm trying to explain here, is that when you have an exceedance of a 1 or an 8.5 or a 9, that does not mean a health effect is going to occur or that harm has been done. I hope that explains that a little bit, and I'd be happy to answer more questions following that. I think I've just shared probably enough of that just to say that these are not bright lines, and consider that when you're thinking about this being an arbitrary number as written in this rule to absolutely shall, as stated in this rule, deny a permit. So the basis for that is faulty. Using these values as a hard stop, rather than identifying potential risks, investigating further, using a tiered approach, I just believe is incorrect. So lastly, my fourth concern is that the basis of this rule relies on fundamentally incorrect assumptions beyond what I just shared, specifically related to the ranking of percentiles. And I believe actually you just brought this up. So I'd like to share a little bit more about that. I'm glad you had brought that up. So rankings are percentiles and are arbitrary. They do not equate to evidence of a disparate health risk or a health outcome. And that has been brought up and alleged multiple times and in the reports of these petitioners. First, percentiles use a screening tool that's an arbitrary way to describe a relationship of one value to another. So for this reason, relying on a percentile for a regulatory decision about a health risk is going to distort the values and lead to a perception of risk merely as an artifact of ranking your numbers and what you choose. In fact, EPA even says in their technical guidance for assessing environmental justice and regulatory analysis in their most recent draft that, quote, an analyst should present information on the demographic characteristics of nearby communities and the environment exposure that they face in levels. For example, percent of a population that's low income or particulate matter 2.5, not just in relative percentile terms, end quote. So converting raw data into a ranking can be useful to identify potentially overburdened communities and compare it. It's critical, however, to not mistakenly equate that actual health risk to higher rates of disease in a community. This rule, unfortunately, stops short of taking a deeper dive into the real data to identify true community-based issues driving your potential public health inequities and using those data to drive decisions. I'd like to show you exactly what I mean by this data and a specific example that I think would be important to the board to understand. Could you please go up to slide 6 within this exhibit? Yes, yes, sir. Thank you. What I'm showing you here is an example straight from the air toxics respiratory hazard index. So this is a map of EJ screen. What I'm showing you here is EJ screen's ranking of an air toxics, the respiratory index. Why I picked this index is because this is the index. I'm just guessing that it's the airport. Oh, I don't, that's a good question. Let's see. So I'll dive into that a little bit more so you can see. Yeah, okay. So the respiratory hazard index, if you can recall, is one of the factors that this petitioner's proposed rule says will be used as a denial criteria, okay? So what is this respiratory hazard index? You can see that it's red in that little area. Red goes all the way up to 100 percentile, right? If you just looked at the rankings, like I said, it shows that you have some census tracts as high as 100 percentile. And that could look really scary if that's all you looked at. But what does it mean to people's health? If you go to the next slide, please. Right there. So that respiratory hazard index data, EPA has their mapping tool. They pull that data from another mapping tool, and that tool is called EJ Screen. So, or AirTalk Screen. That AirTalk Screen is what I'm showing you here. So when you dive into AirTalk Screen, what you're looking at right here are the actual values, the hazard index values, not rankings as a percentile. What you first see in Bernalillo County looks like the county's pretty similar to the state of New Mexico with those colors, which are just kind of gray. And it looks like the state of New Mexico is pretty similar to most of US. Now, if we look at Bernalillo County's, most census tracts are also about the same across the county, except you see 2 census tracts that have a respiratory hazard index equal to 0.5. The definition, again, of a hazard index is that everything is below 1 means that adverse health effects are unlikely to occur, even for potentially sensitive, vulnerable populations. That is an EPA definition. So let's compare the data side by side. In the next slide, please. Down, or, yep, keep going. No, I'm sorry. I'm doing it. That's it. Thank you. On the left side, I show you the hazard index values, specifically with those 2 census tracts. Those are the actual raw values. On the right side, I show you the EJ Screen results. On the left, all the values are below 0.5, or they are 0.5 or below, which I've said means that health effects are unlikely to occur. But when you rank these values, because they're simply arbitrary and you're ranking it across basically the lowest to the highest, which is only 0.2 to 0.5, you get on the right side, 0 is 0.2, but the red color is 100th percentile, which equals the 0.5, right? So even though it's 100th percentile, EPA still says that those levels are unlikely to cause adverse health effects. I hope that makes a little bit more sense as to what I mean by arbitrary nature of a ranking, and that you cannot say just because an EJ Screen tool shows an area in 100th percentile that equates to having health problems in a community. For example, even another map, which I don't bring up here, but you could take a look at the air toxics cancer risk map for the same county, and it doesn't even line up with cancer prevalence in your county. And it's not surprising, it's because these tools are intended to look at something different. They're not actual cancer data. So that could mean either the chemicals are being regulated at levels that are protective of public health, or cancer prevalence may not even be driven by chemicals that are being associated with that. Overall, there's no documented scientific justification in this rule or the supporting data that have been provided by the experts that have testified for why this rule would use screening level rankings as a main driver to force applicants into this arbitrary, extensive process to deny a permit and require additional controls and monitoring that may not even align with the highest identified risks in your community. So lastly, I've just provided you with some of these technical flaws that I believe are of great concern and that I'd like you to consider as a board. Over the past week, I can say that I've seen this board really want to develop thoughtful evidence-based approaches. And I will say that I've seen this board ask a lot more questions than I have on a lot of boards I've been on. And I appreciate the time that you're taking. I also I know that you want to ensure that the quality of your air is healthy for everyone, not just vulnerable communities. It's my opinion that promulgation of this proposed addition really is illogical, inconsistent. It's not data-driven, and I believe it'd be premature. I repeatedly state I have concerns with this rule and its inability to implement. As I've listened over the last couple of days, and being that you've asked a lot of questions about specific recommendations from some of the experts, I thought I'd just give you a few, and I'd be happy to answer more. But here's some things that maybe are worth consideration in the immediate. I encourage you to start simple. I encourage you to make a rule that's flexible, fit for purpose to your county. What do I mean by that? I mean, you need something that's clear. This isn't clear. So if you start simple and clear, at least it's implementable. And I'd be happy to share some of my experiences and the way we've approached that in Colorado. I'd be clear about the objectives. Like I said, it seems to be getting a little bit murky because there seems to be a mix of environmental justice objectives and a mix of wanting to control and regulate air toxics. In many states, air toxics regulation is independent of a community because everybody deserves the right to have clean air. Separating out environmental justice and air toxics. Consider how you can integrate EJ considerations into maybe the current permitting rules, into Reg 41, I believe. EPA has pretty good guidance also, specifically for states, about environmental justice incorporation into air permitting. They recently put out a frequently asked questions document. And using, say, EJ Screen is an example of a way to do a preliminary analysis that can be embedded within your current regulations. And until there's really a state-specific EJ tool that's been well vetted, that's been evaluated for its applicability, I believe that the EJ screening tool by EPA is a great place to start. It's been built by experts such as Dr. Sheets that you heard, alongside experts at EPA. It's being used by all federal agencies in many states, and it's been reviewed by the Science Advisory Board or one of the Science Advisory Boards at EPA. It also has recommended methods for how to apply the results in permitting. In fact, EPA has gone through quite a bit of effort to develop an EJ index. And they also have something called supplemental indexes that are ran literally in like 5 minutes with this tool. And in fact, those index values combine social determinants of health and environmental factors using an equation that they've come up with to weight specific factors to give you a snapshot of cumulative impacts and vulnerabilities in a community. So it can be used as a decent screening criteria. I also highly recommend that you use their recommended percentile, which is 80th percentile. It's what EPA recommends as a starting point. I have reviewed your department's environmental justice strategic plan that they proposed to the EPA. It was quite impressive. I believe that I would consider taking a look at those programmatic changes as part of an overall environmental justice approach. It's my expert opinion that it provides a comprehensive, fit-for-purpose, evidence-based approach to address potential disparities in a manner that's consistent with your local needs and in a manner that's consistent with EPA's environmental justice principles in air permitting. This requirement in this rule is very prescriptive. It's not scientifically sound. It's not fit for purpose. It's very generic. My thoughts lastly with regard to the risk assessment of the air toxics part of this rule. if you choose to adopt that part. First, it would be my recommendation to not adopt that part. There are so many flaws that myself and my team of experts here, my colleagues, had a really hard time of even redlining it because it really needs to be restructured in a manner that would be consistent with EPA's tiered, iterative approach that builds upon information as needed. However, if you do consider adopting it, I would ensure that the methods are consistent with EPA's approach as outlined by their air toxics risk assessment manual and as outlined by other states like California. I would recommend you do not require a permit denial, especially from an unmitigated emissions scenario. And I think you've heard about that and you will hear about it from my colleagues. It simply makes no sense when we're talking about lifetime cancer risks. I would consider removing the comparison of the risk assessment result to air toxics cancer risk or respiratory hazard index county average. For both the risk, like I said, the cancer risk and the county average, there's just absolutely no grounding, no precedence for that. And lastly, I would ensure that there are reasonable off-ramps to work with the department to meet specific risk thresholds. And what I mean is that you would use modeling to inform further risk management decisions, such as control options, air monitoring, et cetera. You would not use it as a ground for permit denial. So while that was lengthy, I appreciate your time. I hope I gave some particular clear information. Thank you.
Thank you, Dr. McMullen. Mr. Laney, I'm going to ask you to now introduce yourself to the board and describe your experiences and your background.
Good afternoon. I'm Carl Laney. I'm a principal with Montrose Environmental Solutions. I work in California, and my department provides permitting, mostly air permitting and compliance management services to industries and government entities in California, somewhat in Arizona, and here in New Mexico through my colleague, Paul Wade. Prior to that, I was on staff at the South Coast Air Quality Management District. I was in the compliance and rule development division for 5 years, where I assisted in interpreting how some of the regulations or how some of the regulated community was managing data or having problems complying with regulation, and developing a couple of key rules for the district at that time. Now that I'm in the private sector, I continue to work with rule development in the state of California through various venues. I work with various agencies, the South Coast AQMD, the Bay Area AQMD, San Joaquin, San Diego, in developing key stationary rules. A lot of them are for internal combustion engines, new source review, some toxics rules. I've also been active at the state level of California in the rule development process representing industry. Some of the rules that were mentioned earlier, those fleet rules for diesel equipment, for portable equipment, for construction equipment, also for diesel stationary engines. These are technology-based toxic rules. They exist because the state recognized that there are other ways to control toxic pollutants rather than through health risk-based solutions, and rather deal with toxic solutions. I also work and represent a client in a consortium in California that joins government, industry, and labor. The purpose is to facilitate the sharing of information and communication among those three key players in the development of public policy.
I am appointed to the South Coast Air Quality Management District Best Available Control Technology Scientific Review Committee, and have worked on other similar committees in rule and policy development.
Can you provide the board a summary of your testimony, your direct testimony, and then your rebuttal?
Yes. I'm going to focus on three things, or three key concepts here, and there will be a little bit of redundancy to what the gentleman from Trinity discussed this morning, but I'm going to try and reduce that and focus on how some of the benchmarks, if you will, in the proposed rule that are dependent upon California regulations, how those California programs as benchmarks really affect the way this rule would be interpreted or how we would comply with it. Through the process, we've always had structural concerns about the rule. As Dr. McMullen said, it's very prescriptive, and it's not that we have concerns about a prescriptive rule. Our concern is about the implications of it being so prescriptive and it being defined without a lot of input from the implementing agency. And we do believe that that is going to be problematic and present risks for a lot of people involved and delay the effective implementation of the program. And I also want to speak to a couple of concepts on data availability and the information that we need in a transparent operation to understand the basis for decisions being made in a rule development process. So the first rule I wanted to talk about has been mentioned several times over the past few days, the South Coast Rule 1401. It's their Toxics New Source Review Rule. And as you may recall, this particular proposed rule has what I will refer to as an off-ramp, an opportunity for people to avoid the bulk of the rule if they make an appropriate demonstration about risk at the front end. And that off-ramp has a health risk threshold, a cancer risk, increase in cancer risk threshold of 1 in 1 million. We believe that came from the South Coast Rule 1401. I believe Dr. Clark indicated that. However, what hasn't been disclosed to the board is that cancer risk in the South Coast Rule 1401 isn't applied to a project or to the emission increase at a facility. It's applied to an individual permit unit, not the project. It's also not the endpoint in that rule. Actually, that rule allows an acceptable cancer risk increase of 10 in a million at the permit unit level, not the project level, if certain conditions are met. And those include public noticing and technology standards. So the 1 in a million was kind of like misconstructed into this rule. And it has a big impact on the value and the utility of this particular off-ramp, especially when you take it into consideration with other provisions of the rule. We've spoken about unmitigated emissions. And this 1 in a million risk level that was originally drafted for a permit unit has now been built into this proposed rule for the project and to be measured with unmitigated emissions. It's important that we understand a lot of mitigation measures, emission control methods or systems can give you 90, 97, 99% plus control. So for me to use this off-ramp or this provision of the rule, I have to inflate my emissions by up to 99 times. That's completely unrealistic. Now let's take a look at the other provisions for this off-ramp. Another key problem in this particular rule that's duplicated or that we see twice in the rule. And that's this linkage of the percentile of cancer risk for the county in that decision once again, we've had discussions about the legitimacy of using this data for screening something versus making a decision. So when I take all of these provisions together, the fact that we're taking something that was intended for a device, the fact that I'm being forced to inflate my emissions beyond what's reasonably expected, and then even if I succeed at that level, I now have to deal with the percentile. What's been presented to the board as an option or an opportunity simply doesn't exist. So in this particular component of the rule, if this is to stand, there are several things that have to occur. Number one, there is no reason for a screening level to be lower than an endpoint decision level, 1 in a million versus whatever that final permitting decision is going to be. The same number should be used at both levels. It only makes sense. The use of unmitigated emissions has no sense to it at all. Again, we're doing a cancer risk assessment. We're assuming that the emission control technologies don't work. These are the same emission control technology that regulators require in permitting. And even if they're not required in permitting, if they're coming into a decision like this through the permitting process, they become part of the enforceable permit. There is no logic in including that. What you're being told is that regulators are mandating the use of technology that's unreliable and doesn't work. Additionally, it should not have any reference to the percentile. And what came out of this particular provision is another important component. Having this off-ramp, if you will, at the front end of the process, we absolutely need tools like screening tables. We absolutely need them. But we should also be given the opportunity when it makes sense to do a detailed analysis to make that very same demonstration at the front end of the rule versus waiting until the back end of the rule. The other thing that we learned through testimony this week is that the screening tool also came from the South Coast AQMD. Again, screening tools are important. A rule like this should have them. It facilitates permitting. It simplifies it, not just for the regulated community, it simplifies it for your staff and allows them to operate more efficiently. However, the screening tool, again, is based upon a permit unit, not a project. It's based upon the meteorology of South Coast in a station that they would have felt to be very conservative, to give them these very, very conservative numbers in their screening tool. I'm not saying that it's not useful in this situation or that it shouldn't be used in this situation, but we have to recognize it's been presented to us and presented to you without your staff vetting its utility. It comes with a very large user's manual that was not included in testimony too. So if any tool is going to be used, we would definitely want staff to be vetting it. The other thing that has come into conversation many times is CEQA. And I don't want to repeat everything that had been said this morning about CEQA. CEQA does have higher cancer risk levels, and you heard that today. They are, and actually acute and chronic risks. San Joaquin, for example, their guidance for a cancer threshold to determine significance, not to cancel a project or deny a project, is 20 in a million. Some agencies have 10 in a million. I would say most have 10 in a million, but it's not a final decision. The CEQA program does have the opportunity to consider overriding considerations. But the other thing that came out of CEQA is this whole concept of mitigation and unmitigated emissions. And I want to make sure that we really do understand what that means and why it's not applicable here. Regulated emission control systems are not considered a mitigation even in that program. So I want to make sure you understand. I think a lot of the conversation glossed over that fact. The other thing is mitigation in that CEQA world that we are not suggesting be applied here in New Mexico, and certainly not through the air program. Mitigation isn't really used that much in air quality. It tends to be more of an issue for things like, the facility doesn't look good. We need to do something about aesthetics. Or the facility passes local noise ordinances, but we also want to make sure that we're being especially sensitive in this neighborhood. So we're going to put up an additional sound barrier. And it's things like that, not so much air quality. It does come into consideration in air quality, like in construction equipment or during the construction phase of a project, or maybe you'd want to move traffic patterns, both because of congestion and air quality, but not typically a stationary source, as a stationary source concept. There are other structural concerns that we have with the regulation, and we've presented this all previously, and there are several, but I wanted to just focus on a few key ones, if you don't mind. Again, we talked about the screening process. We talked about the treatment of unmitigated emissions. Another prescriptive measure that's in the rule, and we talked about this, or we heard about this morning, is the 70-year assumed lifetime exposure assumption. The rule says 70 years. Just understand it does not give staff at the department the discretion to really understand and apply a lifetime exposure that makes sense for the project. We heard about how it is not necessarily the norm. Since 2015, we are not using 70 years. I want to make sure you understand, we use 30 years in calculating cancer risk as applied in this rule. To be conservative, we might use 70 years for determining a cancer burden. Some districts do still want to see a 70-year risk assessment, but it's not certainly the norm, nor is it the mandate. It's especially important in this rule for various reasons. I do think we need to understand there's two concepts here when you talk about that exposure, one of which is residency. The other is what truly is the life of a project. I don't have many clients who are making investments for 70 years. In fact, what I'm learning is, at least in California, just because of the regulatory programs and the evolution of technology, these investments are being made for very, very short times. We're permitting a power plant that we know is going to be obsolete in 20 years, but it has to be built. So 70 years isn't the answer all the time. What really is important, though, when we're talking about this in this particular rule, is another concept that's come up a couple of times, and that is the treatment of portable equipment and relocated equipment. These are not long-term projects. The portable unit is portable by definition because it's there for a year or less. So 70 years, and their inclusion into this program really is questionable. And relocation in this county is kind of unique, and my colleague Paul can talk about that a little bit, but you do have permits that are not being relocated. How do I say this? The permits that are written to them and the rights that they have under those permits today specify their ability to be relocated. So our recommendation at this point is that portable equipment and relocations, because of the constructs of the permit today and because of the short-term nature of their operation, not be included in this regulation. We've had a lot of discussion about AP 42 as a practitioner in permitting. I agree with the concept that we don't like using AP 42 if we don't need to. Sometimes it's the right thing to do. And this is another situation where the prescriptiveness of the rule is binding the hands of your staff. Staff needs to be able to make sound professional and technical decisions. The conditions for allowing AP 42 in this rule seem awfully prescriptive. And that the language of being the preponderance of evidence just doesn't belong here. Staff needs to be able to do staff's job. They need to be able to operate effectively. They need to be able to respond to the nuances of individual industries, of individual equipment units, and the availability of technology. Again, sometimes the right thing to do is to use AP 42, especially in the world we're talking about here with hazardous air pollutants. AP 42 may be the best source of data. Now, what does that mean in the permitting world? Well, what happens in the permitting world is if someone uses a reference value like AP 42, and there are other references out there too, the state of California has references, South Coast has a certain level of reference emission values. But when those reference values are used, and if their use makes a project marginal in any way, the regulators will require testing, and they certainly have the right to require testing and commissioning to show that the project actually meets what was assumed at the time of permitting. So it doesn't present the same risk that I think you may have been advised that it does. There's also been a discussion about averaging in AP 42. Just know that emission source tests and source test protocol includes averaging also. It's a snapshot in time. It might be that facility, or it might be something more recent. And certainly I encourage using that kind of data. But just know it's an average of multiple test runs. It's not the highest of the test runs. That's not how permitting occurs. So the provisions on restricting staff's actions are problematic. These are examples. There's also the prescriptive use of racked, backed, and layer. The problem that we have with this is we still don't know what the objective of the rule was. It seemed like this was a toxics rule, but then the permit acceptance and denial pulls into the concepts of applying backed. You already have a new source review program. You already have a process that determines when backed is applied or not applied. These are for criteria pollutants. You have a process that helps you understand, regardless of the technology, what are the actual air quality impacts. So the crossover of toxics emissions control and solving a toxics emissions problem, if it exists, with, and I mean a localized problem, solving that problem by trying to correct a criteria pollutant problem that might be a regional problem and not a local problem doesn't make sense in this rule. It's biting off a lot. It's complicating things. It's overlapping with the existing regulatory program, and sometimes it's confounding that program. And then there's the last example I think I want to talk about today is the compliance demonstrations, AKA testing and SEMS. SEMS is not a suitable solution in all cases. It's not necessarily feasible, especially when we're talking about the types of pollutants we're talking about here. Keep in mind that when we get to the back end of this regulation, it does not discriminate between toxics and criteria pollutants. It says testing, it says SEMS. When SEMS aren't available or isn't the right solution, then the regulation says you shall test quarterly. It takes a quarter to get through the protocol process to do a test. I just oversaw a project with a test of a class of pollutants. It was $84,000 to be conducted on a quarterly basis. So when people tell you that this is cost prohibitive, and when I look at, say the data that the gentleman at Trinity presented, for different reasons, I see some really, really, really big obstacles. Regulators when they require testing, they're usually looking at somewhere between 1 to 5 years on tests, most often once per year, sometimes once per 3 years, and sometimes 5 per years or per 5 year. But that's complemented with other things, and that's with process monitoring. And you heard a little bit about this morning. We assure compliance, not necessarily only through source testing. We assure compliance through processes that are mandated in the permit. Monitoring the temperatures when you are injecting ammonia into your emission control system, monitoring back pressure to make sure that it's within specifications, monitoring fuel flows, monitoring a lot of things that allows you to not have to test as frequently as this rule prescribes. So I would like the board to consider these kinds of things that are built into this rule. They were built into the rule without the expertise and the coordination and the participation of staff. And if this rule is going to be adopted, we need to have something that staff is weighing in on that complements what staff knows about what binds them at the federal level, at the state level, at the local level, what they understand about the industries they regulate, what they understand about the technologies that they regulate. And that hasn't happened yet. And it doesn't mean it can't happen. It just hasn't happened yet. You've also had some conversations over these past few days about the data and the reports and everything. And we're in a rulemaking process, and I understand the feeling that we can't go back or that you may not want to go back to square one. But I think we all have to admit that there's not the same level of transparency and the same level of robust data in this particular case that I would hope you would normally expect. It's certainly not what we're used to seeing in the rule development process. We haven't seen any discussion of who's going to be affected on the regulated side, on the community to be protected. We've had discussions about the recent adoption of your on-road program and basically the adoption of the California on-road program, which is clearly going to have impacts for the communities that we're talking about. We haven't seen any indication from staff on, does that change the way we should look at this rule? It hasn't been presented to anyone. We haven't seen cost data. And I want to make sure we understand when we talk about cost data, we're not saying, oh my God, this is going to be so expensive, it should not happen. The reason of having cost data is to help the decision makers prioritize their strategies. We may find that another rule concept, a focus on an industry, a focus on a technology-based versus risk-based, might actually get you to the same means and cost less. Might be faster, I don't know. We don't know because it hasn't been done.
Carl, could you wrap up? Because I think we have quite a bit more with Paul.
Actually, I am finished.
Okay.
Are you doing okay? Okay, let's take a 15-minute break, especially for our court reporter. There we go. If we can get settled, please, we'll get started up again. Thank you.
Yeah, okay, okay, okay.
All right, Mr. Domenici, you can begin with Mr. Wade.
Paul, will you introduce yourself to the Air Board, please?
Yes, my name is Paul Wade. I'm with Montrose Environmental Solutions. I'm providing technical testimony for the parties represented by Pete Domenici.
Go ahead and talk about your background and experience.
I have been involved with permitting in New Mexico and Bernalillo County for 30 years. I have personally prepared more than 50 Part 41, Part 60, and Part 61 permitting actions. That includes several Title V permit modifications and renewals, and one PSD permit modification application. With each application, I have prepared and performed a cumulative dispersion modeling analysis for NAAQS criteria pollutants, and for most of the Part 41 permit applications for construction processing, material processing, so like asphalt plants, concrete batch plants, and aggregate plants that I have helped prepare and work with the department on have been issued. Within a short time of these facilities having their initial permit, they've had to renew or not renew, but modify. Usually once they get started up, they realize that there's some shortcomings in their permit, or they need to add equipment to be able to produce and provide the materials that they sell to their clients. So they'll have to modify their permits. I have performed more than 15 Method 9 compliance tests for opacity, and have performed 2 compliance audits within Bernalillo County. So like I said, my clients include the construction industry sources such as asphalt plants, aggregate plants, and concrete plants, but also permit within Bernalillo County electric power plants and manufacturing processing plants. I have also prepared Part 39 applications for gas distribution facilities and for emergency generators. That's kind of my experience. Well, I guess my education is I got a BS in mechanical engineering from the University of New Mexico. Before that, I got a bachelor's in secondary education with the emphasis on industrial arts.
Can you provide a summary of your testimony? Your direct testimony.
Okay. I just want to make a simple comment right off the bat about like I said, I've been doing this for 30 years, and within that 30 years, I've been involved in several rulemakings within New Mexico and within Bernalillo County. In all those cases, either the department or my clients would contact me and say, there's rulemaking going on. We'd like you to get involved. For this last round, this whole environmental justice issue, there was never any contact from the department or from any of my clients that this action was going on and would you please get involved? When I talked to my clients, none of them had ever been notified that there was a work group that was going on. So I'm a little disappointed that all shareholders or stakeholders were not involved in the initial development of this rule. It could have come out with a lot better rule developed and be able to be implemented. Besides that, I guess, the other thing I wanted to say is, my clients aren't adverse to involving a risk assessment in their permitting actions. They just oppose regulations that don't include technical data and permitting procedures developed by the department for identifying health risk and the methodologies for determining realistic permitting procedures to address environmental justice. If there is a continued development of the department's plan that they have presented, as a shareholder working group, I think something could be developed that would be able to be attached to Part 41 and be included in the permitting process as you go through the Part 41 permitting process. I had several comments in my written direct testimony. My first comment was, Part 41 presently has conditions to address hazardous pollutants and impacts on health of HAPs on public health. The regulation presently has de minimis levels of HAPs pollutants that would require a Part 41 regulation. These are, this regulation is in 20.11.2.3b. If a facility had a single HAP that was 2 tons or a combined HAPs that was 5 tons, that would require them to get a permit. Now, most of the permits I'm working with, it's the criteria pollutants that cause them to get a Part 41 permit. But like I said, this is already addressed in Part 41 as levels that have been approved by the Air Quality Control Board for the Albuquerque-Bernalillo County regulated air quality permit sources. To enhance compliance with, you look at 20.11.41.17.c, which is the basis for a permit denial. There is the permit can already be denied by, if it's identified that the HAPs emissions from the facility have a danger to the public health. So that can be expanded and used as a basis for putting in a department plan that they have been trying to develop to further enhance that permit denial regulation, condition in there, in the Part 41 regulation. My next, and as a basis for that, that would automatically start addressing environmental justice issues. If part of that strategic plan was addressing some of those issues. My second comment was, presently permitting timelines from the beginning of the department's notification for a permitting action for a Part 41 application is anywhere from 5 to 1 year. Now, that does not include the pre-process, which is submitting a modeling protocol and the pre-application meeting. The modeling protocol takes up to 6 weeks. And if they don't like the modeling protocol submitted and suggest changes, then you resubmit, and then it can be up to another 6 weeks to get that approved. But they're very, I mean, it's been my experience with the department. They review those modeling protocols and make sure it meets all the requirements that they expect from the permit application. So right up front, they're looking at how you're going to do the modeling and being very prescriptive on what they want to see in the modeling analysis. So it can be anywhere from, you know, it can take anywhere from 5 months, which is a good turnaround, to a year or more to get a Part 41 permit application. In review of petitioner's version 4, the only timeline that I see is an administrative completeness determination after 30 days. That's real hard for me to go to my clients and say, you can get an application or you can get a permit in this time frame, because there is no time frame. It's not specifically spelled out in the proposed regulation. When I do a permit application, I have to, every single time, and this goes to, you know, Part 41 permits, relocations of portable sources, and again, you know, not particularly Title V renewals, but Title V modification, where you'd have to go through a Part 41 regulation, or a PSD permit. Anytime you're changing the facility and adding additional emissions, you have to do a cumulative analysis. And I know Mr. Salente's discussed this extensively. But I'm just going to point out that when you do a modeling analysis in Bernalillo County, the first thing you do is you're going to submit your facility's emissions based on its maximum production and maximum allowable operating hours into the model, and that's being addressed for and using 5 years worth of meteorological data for a 5-year period. You also include neighbors of the same pollutants that are surrounding that facility, and you're including them as if they were operating at their maximum permit allowable emissions. So those two right there make any modeling analysis very conservative. But then you're also adding in the background that's recommended by the department into that analysis. Now, the background already includes those neighboring sources that you've included. So you're again making it conservative. Now, those backgrounds also include, I mean, it is background. So it's measuring the particulate emissions or the NOx emissions or, you know, SO2, CO, any of the criteria pollutants emissions from the air in that location. So when you're modeling, you discuss with the department what's the representative background that you want to use, and they'll.
Mr. Hearing Officer, this is Maslin Locke with the petitioners. Sorry, hi. I would just like to, in the interest of time, maybe object to Mr. Wade testifying to what's duplicative to what Mr. Salente testified to earlier, which I believe was pretty much the entirety of the modeling process and how it works.
If you can have him move on.
Yeah, Paul.
I can do that. I guess there was one question that was asked. How does the department select the neighboring sources? And the short answer is they look at where the location is. They look at if there's major sources around, and I'm talking about major sources, I'm talking about the major sources of particular emissions. And they have decided that even though those are part of the background for your area where you're going to be located, let's be conservative and add in those neighboring sources just to give the model, just to give the an output that's as conservative as possible, that represents what the possible maximum is going to be from your sources and every other source around you.
Let me just ask, you attached as an exhibit, the guidelines for air permitting or air dispersion modeling guidelines? So this is, what was our NOI? I know someone told me.
189.1.
This would be
Exhibit 4 for. So there's modeling guidelines, and
I mean, I don't want you, I'm not gonna ask you to go through them. I just wanted to
right.
make it.
I mean, the modeling guidelines are part of my, written testimony. So I'll move on.
So let's talk about this proposed rule. And I know you did some analysis of the overburdened community definition, and they did some mapping based on that. Is that correct?
Yes. Let's see which exhibit that is.
So those maps are.
Oh, they're within my written testimony.
Yes, they are. But could you just indicate what you did to create maps as shown on in part 4 in your.
Yeah, okay. Based on the petitioner's, part 42 or part 72 version 4 rule, we downloaded some of the health indicators and tried to lay that over on the Bernalillo map. And I think that's part of my written testimony of those maps. It basically showed that if you use the 50 percentile, you're covering most of Bernalillo County, at least the populated area, at about 80% of the census tracts, and about 79% of the population would be considered overburdened. I then just took that same map and said, what if we just looked at 80% of the 2 health indicators? What would that represent? And
It's yeah, is this, Paul, is this, I don't know if you can see that.
oh,
I'm pointing to a map on the screen.
okay, is that that's the 80% one?
That's using.
Okay, there's.
That's 2 factors.
Yeah, that's 2 factors at 80%. Oh, is it? I can't see that.
Okay, well. Okay, so this is 50, that's figure 1 for the record.
Yeah, so that you can see that takes in most of the population of Bernalillo County. If you go to the next one.
So that's, for the record, that would be figure 2. And first of all, who created that map, figure 2?
Montrose created that map.
And what does that depict?
That depicts the, is that the 80%? That's 80% with two health indicators. And again, we only looked at the health indicator, or Yeah, environmental health indicators. So you've significantly reduced the amount of area, and with the 80% in the two environmental risk factors. I'm sorry, it's the environmental risk factors. At 2, you're only including 130 of the census blocks, which is about 28% of the county and about 25% of the population. So it's still a significant amount of population that it's being included as a overburdened community. And then go to the next map. This map represents if you went to 3 environmental risk factors. Again, you see, it significantly drops it down to about 28 of the census blocks and about 5% of the county population.
And then did you do some mapping to overlay zoning?
Yes.
Is that table 4?
Yeah, in figure 4, again, this is going back to the 50 percentile. Underneath the gray is where there's some zoning. You can see some zoning still that's available to be industrial zoning or commercial zoning outside of the gray area, but it pretty much covers up all the potential areas for zoning in the city. Now, this is just the city zoning map. And figure 4 is in northern part. I just did a kind of a closer view of the area. The green dots are the listed in stationary sources that are listed by the department on their map. And in figure 5 is the next one is the southern part of the county. So this is 50%. The next one is the 80% with 2 risk factors or environmental health indicators. Or environmental risk factors. You keep getting that mixed up.
So that would show some available.
That would show some available industrial area, industrial commercial area that can still be developed if it's not already. But you still have a significant part, which, based on these environmental risk factors, you still are looking at where the Big I intersects as, overburdened community or overburdened because of mostly traffic. And the same thing with 6 is the northern part of the county and figure 7 is the southern part of the county. If you move on to figure 8, that's the 80 percentile with at least three environmental risk factors. Again, it's kind of, you start seeing where the actual environmental risk factors are most significant. And it's right at basically around the Big I in the downtown area. And, a lot of the rest of the county is opened up.
So 8 and 9 are read together as the north and the south.
Figure 8 and figure 9 are the north of Bernalillo County and South Bernalillo County, kind of zoomed into the main population areas.
You have a long description of or discussion of the EPA's air toxic screen data. Could you just summarize what the importance of that is?
Yeah, well, I mean, this this is really the cancer risk that's that's an EJ screen that comes from air tox screen. That's it, inputted into EJ screen. The first table that I have here in my written testimony kind of describes what the indicators are that they use to do their analysis and a definition of what they're looking at. So you have the point source risks, which are the stationary sources and their contribution to cancer risk, on-road risk, non-road risk, non-point risk, which includes a lot of things that are not particularly defined as a stationary source or a point source. You have fire risk, from wildfires, biogenic risk, which is the natural emissions that are in the air from trees and plants and soil and stuff like that. And then the secondary risk, which can be contributed by industry because it's the contribution from the emissions that go into the air and then convert to something else. And then you've got background, which is, it could be emissions that get transported from somewhere else into Albuquerque. It's stuff that's not created by humans in the area. It's something that's created outside. So it could be the transport of toxics from some other area.
Mr. Domenici, I hate to interrupt, but I think we're getting a little repetitive.
Really?
From prior testimony. I'm not
Okay,
sure.
We'll move on. Let me direct it with some questions. So can you turn to section 6 and primarily discuss temporary relocations? And really my question specifically for you is, can you describe to the board what the permit approval process is to relocate a portable source?
Yeah, the permit process for relocating a portable source is very similar to the process to get an application as far as modeling goes. So you have to do a complete criteria pollutant model to show that the facility located at that spot, and usually you're still using that 5 years worth of data, can locate there, even though they may be there for only a couple months, can be located at that site and still show compliance with ambient standards to their restricted boundary. The 5 years worth of MET data is used to allow for the potential to find an atmospheric condition that happens within the area within that 5 years worth of data. Because as we can see, some years are a lot different than other years. So you use 5 years worth of data to kind of try to grab potential meteorological conditions that could cause the worst condition in your dispersion modeling analysis.
So to temporarily relocate a portable source, does that source have to have a sort of a home base permit?
Yes, I mean, what you're usually applying for first from the department is a home base permit at a specific site. And then for portable sources, then you move to, you request a relocation and you do the modeling, you submit an application, they do a review for a different site. Usually there is only one. I mean, usually you're looking at, again, like Dr. Clark said, you have asphalt plants that could be portable sources, aggregate plants, or concrete batch plants. There is only one asphalt plant that is realistically a portable source in Bernalillo County, but they haven't operated as a portable source in Bernalillo County in probably at least 4 or 5 years. All the ones that are existing in Bernalillo County are pretty much stationary sources, and it would be a significant effort to move them to other locations, having to do with the 2 newest ones operate on line power, so they don't have portable generators. So if they wanted to relocate, they would have to modify their permit to include portable generators in their permit. Since they don't have that, they can't just pick their plant up and move it somewhere and operate unless they put in line power, which is not something you would do for a portable source for a short-term relocation.
In Dr. Clark's testimony, written testimony, and then I think in his oral testimony, he opposed an exemption for portable sources. And one of his bases was that the portable source could move, I think first he said a block, and then later he said a foot. What discretion does the Environmental Health Department have to deny a relocation like that?
They would have significant discretion to do that. Just like if you put in a permit for half a facility and then and you get permitted for that, and then you apply for another half of the facility at the same location, and then you only have to look at the equipment that you're adding in. They understand that's you're kind of trying to cheat the system. Right now, for a portable source, you apply for a location in a certain area. They say, okay, you can be there for a year. They're not going to allow you to say, okay, I'm just going to move it a foot away. They would not approve anything like that. Even if you tried to move it a block away, they would not approve that. And for these portable sources, you're mostly talking about aggregate plants or concrete batch plants. And when you locate a portable source, an aggregate plant or a batch plant, most recently, let me talk about some of my clients. Mountain States relocated a crusher to the I-40 Unser egress area to prevent them from having to pick up the material that they've from the destruction of the project or the removing of asphalt, driving it all the way down, and in their case, it's driving it all the way down through Bernalillo County, all the way down to Los Lunas, processing it, turn around, load it back up in trucks, drive it back up through Bernalillo County, through Albuquerque, back over to I-40 and Unser. So the movement of that facility to that location for the amount of time that it needed to be there was going to reduce the amount of truck traffic incredibly. And as has been pointed out by many people, it's diesel pollutants, mobile sources that are the main drivers of toxic emissions in Bernalillo County. So trying to reduce that truck traffic is a positive impact for the environment. Next, I mean, you're going to have the I-25 Montgomery interchange is going to be going through a reconstruction. I know that they're looking at and wanting to be able to move, a facility, some sort of facility to crush the material there. So again, you're not having to load the trucks, drive it to a different location, process that material, bring it back to that location, and then reuse that material. So it is actually a positive benefit to move those plants to where the projects are. Same with concrete batch plants. The surfacing of the airport, moving a concrete batch plant inside of the airport there, so that you don't have a lot of truck traffic from going into the city to the airport, significantly reduce the amount of emissions from truck traffic that happen. And you got to also look at, when you have truck traffic, you have the potential for interference with public traffic that's driving up and down the road. And it's definitely a safety hazard, especially if those trucks are getting on the freeway from a freeway project. They have to wait, get on. They're going to be driving slow. Traffic is going to be trying to get around them. It's just a potential for accidents to happen. So it is always better to try to locate this equipment so you're not having to take that material and drive it away. So that's why there is portable source relocations allowed to kind of address those kind of issues.
Did you prepare a written rebuttal testimony?
I did.
Can you, let me look at that. So can you summarize that? It seems like you were focusing on some specific terminology in the rule.
Well, I'll go through my first one. I mean, I don't think I need to talk about my first ones because it's been discussed extensively on why EJ screen is not a good basis for this regulation. I'll go to the next one, and again, this has been discussed extensively. Using unmitigated air dispersion modeling demonstrations. It just.
I think we've heard about that. Let's
well, I just wanted to say that the modeling itself is already very conservative. Now, just a quick discussion on a permit. When I do a permit, I try to make it as flexible as possible for these facilities, and that's to accommodate the fluctuations that go on, say for an asphalt plant or aggregate plant or a concrete plant. When they may have a job, they have to be able to respond to the demand for that material. The next day they may not operate at all. So you may have one day when you're doing 4,000 tons of asphalt, the next day you're doing nothing. So the permits are allowed to, the conditions of the permit are, applications are submitted to respond to that flexibility. That's where I have a lot of problem with discussions with the public, is they look at the flat numbers. They don't understand that those flat numbers that you see in the applications are really realistic to what's going to actually happen. It's just to allow the flexibility of the company itself to be able to respond to their clients' needs.
Then I think you talked somewhat about I'll call it the MET data. Were you concerned that the language in the rule indicates 5 years of MET or ambient?
Well, what my first concern when I saw version 4 was it said it had to have 1 year of meteorological data and 1 year of ambient data and ambient data. In my world, in environmental world, when you say you have to have 1 year of ambient data, that is monitoring data. So they were requesting a meteorological station to be placed at the site, and they were also requesting a monitoring data to be placed at the site. I don't know if they intended that, but that's what the rule reads. They don't say what pollutants they wanted monitored. They just said that you had to collect 1 year of meteorological data and ambient data. To put in a meteorological station is probably about $100,000 to operate for a year. To put in a monitoring station is probably around $200,000 to run for a year. So that's is really expensive. Then in version 5, he did put in the caveat that you could use 5 years of meteorological data from the National Weather Service. And that's good. That's basically what EPA says and what most of the people do in Bernalillo County and what's required by the department. But there's still that condition on and ambient data. That was still in that condition. Then in the last condition, the last version of this proposed rule, the 5 years of meteorological data was pulled out again. So it just read 1 year, you have to have 1 year of on-site data and ambient data. So I don't know which version is the correct one that they are proposing, but the inclusion of ambient data in that requirement is a real issue. And it's not addressed by saying 5 years of National Weather Service data. So that automatically adds a year prior to even applying for a permit that you have to have to go through the permitting process in your Part 72, the proposed Part 72. So for a short term, even if you're if you're doing a relocation the way it's addressed now, if for some reason that relocation of an aggregate plant or a concrete plant would require under the rule to do
Let me interrupt you. Would it be better to say 5 years of Met data?
period. I think that's was the intent, but if you put these vague terms, the department would have looked at that and said, ambient data, oh, they mean monitoring. You have to do monitoring.
Okay, let's move on. So I'm on page 3 of your rebuttal. You disagree with Dr. Clark's assertion that concrete batch plants and aggregate recycling plants emit many HAPs. Is that your testimony?
Well, I don't know what it means, what his definition of many HAPs. And that was my problem. And I wanted to kind of present, and I know this asphalt plant has been discussed over and over again. It's located in the South Valley. It's Albuquerque asphalt. But I want to address what they consider, what's in his permit presently. It does not list a single HAP pollutant that's over 2 tons, and it does not list a combined HAPs pollutions from the facility that's over 5 tons. So by definition of Part 41, it's insignificant for HAPs for permitting purposes. I also want to address the amount of effort that Albuquerque Asphalt put into to try to limit the amount of emissions that it was going to be putting into the air. They knew the concern, and I talked to them at the very beginning. They knew the concern of where it was going to be located, and they tried to address a lot of that by taking specific conditions in their permit to reduce the amount of emissions. And since then, they've changed their operation that also reduces their amount of emissions. Number one, the facility is run on line power. So there are no diesel PM that's powering generators at the site. Now they did in the permit have a recycle plant that had a diesel generator. They have since removed that diesel generator, and they've connected that the processing of RAP, recycled asphalt. They've eliminated the engine, and they put that on line power. So there's basically no permitted diesel generators at the site. The plant is allowed to use on-spec fuel oil or natural gas. On-spec fuel oil, really the only difference between the two, because they're both combustion emissions, is natural gas has a lot less sulfur dioxide emissions from it, because there's not as much sulfur in in natural gas as there is in on-spec fuel oil. So they basically run on natural gas. When they bought the plant with the best technology. That best technology redirects the flames that heat them dry, the aggregate, away from where they add the oils. So you're not getting direct flames on the oils that burn up VOCs, and then you've got VOCs emitted in the air from heating up the oils.
Mr. Domenici, I'm not sure if this is responsive to your question. I think he's going into a particular location as opposed to your general question about asphalt I'm
talking about the many HAPs and how they.
Well, hold on. I want to wait for Mr. Domenici's response.
So let's just do this by question and answer. So
if you can just listen to the question and be specific in your answer, if you could, please.
So.
And Mr. Wade, you need to trust that this board has read your written testimony and rebuttal, and you can trust that they're going to have questions of the entire panel. So please trust them that they've reviewed this. So when Mr. Domenici asks you for summarizing, focus on the major points and keep to summarizing. Thank you.
So I think I'm gonna well, do you want to add one thing about the HAPs at that specific asphalt plant?
There is one thing that when I talked to them about it, one of the major issues with asphalt plants is blue smoke generation. So that's basically VOCs that are emitted into the air, and you can see over some older asphalt plants a blue haze over the top of them. So to address that issue, we Albuquerque Asphalt installed a recirculation system. As the asphalt comes out of the drum, it automatically starts to cool, and that's where you condense and you get condensed PM, and you get to condense the VOCs. So the recirculation system draws those pollutants and puts them back into the drums and reburns them to try to get rid of them.
Let me ask you, did you attempt to prepare a red line of I think it was version 4 of the proposed rule?
Yes.
And that's attached to your direct testimony?
It is, but I did not print that out.
So I'm really want to ask you about the color scheme.
Okay,
So there's red line changes, and then there's a lot of yellow. Just so the board's clear when they review this, what is the yellow?
okay. The red lines are either adding information or, the strikeouts or the red color. So there's red strikeouts and red lines that are added in as color. When we went through, we looked at some of the language of the permit or the proposed regulation, and we just were not clear, so we highlighted those with yellow. We don't really have a suggestion for those pieces. When we start, looking at it as a whole, there's so much that needs to be addressed, that even with our red line proposed changes, I can't say that we can really accept that as we agree with everything else. We just tried to address some major concerns and then left some open. Now, the yellow lines also, the yellow highlighted areas are areas where we think the department should have a major input on how those are addressed.
Let me just ask you to look at one section, which is the permit denial criteria.
Permit denial. Yeah, then one thing we did try to add, and as a way to look at, there was a lot of discussion in here about backed, racked, Lear, that are mainly for criteria pollutants, but we decided to say, and this was part of what the department had discussed in some of the negotiations, was using an optimal control strategy that would be developed by the department to address concerns on how do we get the best technology in to address the emissions that are being emitted into the air from a particular facility as they go through the permitting process. That was also, we had proposed that as one of the off-ramps, looking at, doing a simple risk assessment. And if you were below a certain level, then that you were drawn out of that. Or if you were up, if you were over that initial screening levels, you could then say, well, I'm going to do the optimal control strategy to try to reduce the amount of emissions that were, of the hazardous emissions that were being put into the air. And that would have been an off ramp for not having to go through the full Part 70 process.
And so would the optimal control strategy be a term that could be used to capture technology that might address HAPs as opposed to criteria pollutants?
Yes, that would be, it would be something that the department would look at or see what's available out there, technically available and, cost-effective available, and then recommend or, even in some cases, maybe prescribe, we need you to do this technology.
There was a question yesterday, I think to one of the Trinity experts, about the difference between backed and Texas backed. Are you familiar with that situation? Are those
Yes.
two different terms?
Yes, I have looked at Texas backed as a justification for control technology in Albuquerque or in New Mexico. You know, what basically Texas did is they went through and they determined some values that they thought was reasonable to be used on control equipment in Texas. So that they have certain levels that they automatically want facilities to meet. It's not the same as back where you're looking at all technologies, you rank them, you do cost analysis, which is a much more labor intensive process instead of just looking at a table out of a Texas document and it says, if you have this piece of equipment, you'll do this. You'll have to at least meet this control efficiency or requirement.
Do you think Texas back, or does Texas back address HAP emissions, or is it more for criteria?
It's mostly for criteria pollutants.
So is there anything out there similar to BACT or Texas BACT for HAPs?
Not that I'm aware of.
So that's more on a case by case, if it's needed.
Yes, I mean, it's, you know, as part 41, you know, you have that condition where, you know, if you're going to be, you know, where they say, you know, cause harm to the public health. You know, if you had a facility that they thought was going to be doing that, I'm sure they would say the only way you're going to get a permit is if you add some sort of controls to get rid of this pollutant.
Okay, that's all the witnesses. I'd like to bring my whole panel back.
Yes,
for cross-exam.
Dr. McMillan, Mr. Laney, if you could step back to the panel seat. Are you doing okay?
Okay.
Mr. Domenici, can you tell me what docket number? I think it's in your rebuttal that he was talking about the red line version that you guys attempted to.
That's actually in his direct testimony.
So that'd be in 189.1. I looked there and I didn't find it, so it's. Please?
I think it's a standalone 189.5.
Oh, that's why I couldn't find it. Thank you.
All right, we'll take questions from the board. Is board member Lewis, do you have any questions, board member Lewis? See if she's with us.
Yes, just give me a minute here. Actually, can you go to someone else and come back? I have to move.
Vice Chair Richards, do you have any questions?
Yes, I'm here. I have some questions. Let me get on video here and I can lower my hand also. Yeah, this is for Dr. McMullen. So I know, and this is probably my only question really. You mentioned the limitations of EJ screen, and you referenced a question I asked yesterday regarding to another person, a witness, regarding using EJ screen as a screening tool, and then supplementing that with local data. And it sounds like you're suggesting that that might be the way to go. Is that correct? Did I understand that correctly? I'm going to lower my blind here. I'm kidding.
Hi. Actually, that's part of why I prompted, and shared some of that additional data, because you had brought that up yesterday. I think that's exactly what needs to be done. It's appropriate for a screening tool to set some basic criteria and allow people like yourself and other, health experts to be able to dive deeper into what the local data really say. Just like that conversation you had yesterday. So it's a good starting point. That's also the consistent framework by which EPA states how EJ screen should be done for an initial screening analysis before you do a disparate impact analysis locally. So in their guidance documents.
Okay, great. Thank you. And I
Yes.
just had a follow-up. I know you had mentioned, I think you looked at the site, the IBIS site. I just call it IBIS because it's an
Yes.
acronym, easy to say. And you mentioned that the data was at a county level and that it was a result of questionnaires. And I've worked in the health department for a number of years in the Epi Bureau there. And actually a lot of that data is inpatient discharge, hospital inpatient discharge data. So I was wondering where you got the impression that that was based on results from surveys.
Sure. I think that the data sets can be different depending on the health indicators. That specific one is what we had pulled that looked like it was self-reported. It wasn't actually hospital admission data, just for the childhood one. That was that specific one that I had looked at.
Okay, and it's, that site actually, it's a little interesting. It can definitely be improved, but there is a section that shows prevalence rates for childhood asthma. And there's also like a behavioral risk factor surveillance system.
Yes.
But in terms of like
yeah.
morbidity, when you're looking at things like cardiovascular disease and asthma prevalence and things like that, it actually is pretty much either utilizing the hospital inpatient discharge data, and it actually is at a more granular level. It's at what's called small areas for Department of Health. It is not at the county level, but it is larger than the census tract for exactly the same reason you mentioned, the whole confidentiality piece. So, so I think where I'm leading, I know you worked in Colorado. What sources do you all use when you were at the health department? Was it also hospital inpatient discharge data as well as the cancer registry?
Yeah, so I'm not an epidemiologist, so I don't want to say too, but I do, one of my colleagues is an epidemiologist and was at the state also. So we typically, when we were at the state, that was some of the same data sets that you're talking about is what we would use. What we found though is when you're at the health department, like you've been, you have access to the smaller areas, so that we don't have as consultants that would be supporting an operator or something like that. So we find that I only have access really to county level data for that reason. So that's why there's great data sets that we use all the time. It's just that we're limited and aren't been able to get granularity like you can at the health department.
Correct.
So that's why,
and I think, yes,
that's why the department would be probably best suited to be developing those tools like that.
And we've actually just sort of as not pitching the health department, but we've done a lot of work trying to get the data out into the public's hands. And I think we've done a pretty good job in the past 20 years, recognizing the need for community to be able to access the data for their own needs. In this state, we really believe in access by the community so they can be, determine on their own what they believe needs to happen in a policy way. So that's all. I just wanted to find out where you saw that at, because it certainly is not true. And we have a very, very robust toxicology or cancer registry as well.
Well,
Thank you very much.
That's what
for
we
your
saw. Yeah, that's what we saw. It was easy to access, and it was great to see that you had that level of data.
Great. Thank you so much. I appreciate it.
Thank you.
That's all I had.
Thank you. Board Member Lewis.
Yes, thank you. Yeah, I just want to reiterate Kitty's points, and also I understand she referenced the environmental public health tracking system that the state has. And I think the lack here is not a lack of data, it's a lack of initiation of agreements to get those data on a scale that would be applicable to some of the assessments. I agree totally that they're not publicly available on that scale, and that, as Kitty and you had also mentioned, Dr. McMillan, is an issue of a very sparsely populated area and an effort to make sure that privacy is protected. But I know when we first started the environmental public health tracking system, that issue of how the de-identified data can be used in just these kinds of ways with appropriate agreements between agencies that have that need had been discussed. And so I think that is, I'm very happy that all of this is being brought up, because I think that is something that does need to be appreciated. And the SERA registry here, as was mentioned also, is an excellent source of cancer data. So I do think that even though those data are not publicly available, they are available and can be accessed with agreements. So I just wanted to make sure that got into the record. And second of all, and I also am a toxicologist for many, many years now. And I understand the points you were making with some of your examples. What I just wanted to also, though, make sure was clear in the record that a lot of the comments that are coming up in testimony are being based on individual contaminants. And I understand for a point of example that that's a perfect strategy. I'm not criticizing that at all. I just want to add to that, though, that I think what the concern is that's being addressed here is one of the health equity. And I totally agree on having to really clearly state those objectives and make sure that all of the pieces of any rule are going to address those specific elements. So thank you for pointing that out. But I think when we look at things like the benzene example, where we have multiple species, multiple endpoints, we have an acute exposure. For example, great. I just want to make sure that everyone on the board and in the record, for clarity, understands that was an example and not necessarily what is going to be used in this particular analysis. And that all of those issues are issues that need to be considered, though, in terms of how do we extrapolate between species? How do we extrapolate from acute to chronic? So thank you for bringing all of that in. And then I think the only other questions that I'm going to be able to stay awake for. Thank you all for your patience with my my bundling and coughing. It's come up now several times in the testimony about the mobile source emissions, and especially the traffic being a primary contributor to the impacts in communities. We've just passed the Clean Cars rule, and I guess my question is whether or not anyone has actually looked at what happens when we remove that source or reduce that source, and how much that source has to be reduced to shift that profile from mobile source to from traffic source, excuse me, to some of the other sources that we're talking about here. And I think, Mr. Wade, you had mentioned, you had brought that up, and I think Dr. McMillan did as well. So I wondered if either of you had looked at that or considered it.
I have not, but it's a very good question.
Mr. Wade, any comment? Mr. Laney? No.
Okay, thank you. And then, and again, this is sort of looking back over all of the times I've heard this, and not just this panel. There's been a lot of discussion about process and the fact that industry wasn't contacted to come into this. And I think those are very relevant points, and something that definitely could have been much more targeted and specific. I know there were public postings. A lot of this happened before I joined the board, so I'm not exactly sure what that process is. My flip side of that question, though, is in the process of permitting, as it's done, and this is probably a question for Mr. Wade, what efforts do any of the industries that are parties to this case make to actually try and go to the well-organized community association structures throughout the county. You know, the county has these very specific, county and the city have these very specific community organizations. Are there ever times when an applicant, before applying for the permit in a timely manner, would go explain what's happening to the community and get feedback prior to developing that permit?
I can respond to that. And there used to be public information hearings, not the formal public hearings that you know are in front of a hearing officer, but public information hearings. I have participated in several of those, and they just were not productive because even no matter what you said, the intent of the public participation was mostly, we don't want you here. So it wasn't a discussion on, you know, what can you do to reduce your footprint of emissions? It was, we don't want you here.
And thank you for that. That's good, I think, for all of us to consider. And I think the next piece of that then is what could be done to change that? Because I work in communities a lot, and I know that, you know, we go in a lot, and one person will invite us in and 10 others will say, we don't want you here. And there are processes by which that facilitation can reduce that distrust and reduce that anger. And if you could maybe address whether anything has been tried or how that introduction to community maybe was handled, what the role of EHD had been in that process, and what we might look at going forward as a way to, I mean, you, for example, just told us several things about the asphalt batch plant that had been undertaken at the beginning. Do you think that the community is aware of any of that?
It was discussed because that particular permit went to a public hearing, and it was discussed during the public hearing how the, you know, and the proposed permit that was part of the public hearing. So it had that information presented in the public hearing. I can say, I mean, even though I was involved in the public hearing, most of the public hearings are the public and the department defending themselves from the public. And I added some information, you know, as the permit consultant. I do not remember any particular understanding. I had a couple people talk to me afterwards saying it was good that you came and kind of explained what you're doing. I understand it better now, but there are still the people that are just flat out, we don't want you here.
So thank you for that. I'm happy to hear there were some people that facilitated increased dialogue. It sounds to me, as from my history in communities and from what you're saying, that there would be benefit to both the applicants and to communities for EHD to develop a more trustful process, and to have that inclusion that would stop the us versus them and make a more participatory process in how do these things happen. And I think, you know, that is a very important piece of how this whole rule has to move forward as well. And I don't think anybody benefits from not being able to discuss issues ahead of time rather than in frustration at the end. So I really appreciate your frankness in discussing that.
And I agree with you fully. And I think the department agrees with you fully. And I think they're putting forward a proposal to kind of address those issues.
And is anyone on the panel aware that there was a directive to do exactly these kinds of things 15 years ago from the board to the department? And that some of this frustration probably is deriving from that long period of time. And so, you know, I think at this point, it really is, how do we move forward in a way that overcomes that lack of momentum?
Was that a question?
Yeah, I asked it.
Okay. The use of the public information hearings that had been devised by the department was to try to address that. All the public information hearings that they had were very negative and did not work, did not come with an outcome that was constructive. So they stopped that process.
Okay. Yeah, I think, yeah. Fine. I appreciate you getting all of that into the record.
I think
Sorry,
board
no
member,
further questions.
thank you, Board Member Lewis. Board Member Eberline, do you have any questions?
Yeah, let's see. Are we doing the whole panel plus one or one person at a time or all of them?
You can ask
Okay.
any
Anyone,
or all of
okay.
them.
We're flexible.
Okay, so I will start with the order that you did because I have some notes about that. Dr. McMillan here, I was glad you see that you wanted permits to be simple and clear and possible, you know, and as I write permits myself, documents myself, you know, I always try to follow the principle. That's the little phrase that is often attributed to Albert Einstein, that everything should be as simple as possible, but not simpler. And the permits I had to write, we have this, that they had to be equivalent, consistent, enforceable, and implementable, which is thinking in line with your thought. But there was something else, there was something else that I had bothered me here for a while, as I had worked a little bit on Superfund things. And it was the use of rags, but you killed that off in here, which I'm glad. So, because I knew that this is not what you do, so you used it for baseline risk assessment early in the stage of the circular process, and not for these kind of documents. So, there was something else. You said something about toxicologists and stuff like that, because I think, yeah, I know at least one toxicologist who would disagree with you. He's also a PhD, but
there's a few out there like me.
Yeah, so I'm not going to raise that issue because I have no more there. We have.
Speaking to the microphone.
Okay. Mr. Lanny is here. What was it? Oh, you were talking about this control technologies. I better look it up. Okay, well, mitigation and here. Oh, yes, you seem to dislike very prescriptive rules. Am I assessing that correctly?
Not entirely. The concern I have with this particular rule is it's prescriptive, but it's not drafted by the department. So it raises the risk that the prescriptiveness doesn't match what the department's capable of doing or what regulations drive the department. I think an example is the risk assessment methodology that you just referenced.
Mm-hmm.
I believe if the department drafted this, they would say something different. I understand the value of prescriptiveness in regulations. We need certainty. And so it's not that in itself, it's the way in which it may or may not complement the way the department has to do its job. I think there are situations, though, where processes, methods, technologies change quickly enough that that should not be in the rule itself, because the rule development process cannot keep up with those things. BACT is an example, best available control technology. The way BACT is managed is outside of regulation. The regulation, I'm not speaking to this regulation specifically, but in new source review will dictate when BACT should be applied or when layer should be applied, but you won't see the definition of it or an emission standard in the rules, because there is no way that the rule itself, you think about your rule development process, and it's in some ways what we're going through today is different in the way it's happening, but the time it takes is not. So the rule development process can't necessarily keep up with things. So there are things that belong in a rule. There are things that do not belong in a rule.
Okay, well, as a permit document writer, I like to have somewhat prescriptive rules because it makes it easier for me. So I have two roles a little bit different here, which is a prescriptive rule makes it easier for me to write things into the permit that needs to be there. And at the same time, I also had to deal with that my reviewers within the regulatory agency, I don't trust them in general. So I need to make sure that I have the rules also written so that they can't force me to do things that are actually in the rule.
I agree. And we agree on that point. The rule needs to be complete. It needs to be accurate.
Right.
So having a prescriptive rule that is not accurate or appropriate or implementable is not a solution. That is definitely a problem. So if all of this language that's in the rule today was vetted or written by the department, and we knew that it is what the department could implement, and it knew that it was in line with the regulations that guide the department, or the policies that guide the department, or the principles that guide the department, it would be perfect.
Right, yes. So you also had this, right? You already raised it. Now they're backed and there and racked. And so if you're not willing to use some of those, what would you use instead? There must be some kind of requirements in the rules.
Well, in this particular case, it comes down to what is the objective of the rule. Is this rule a toxics rule? Is it a health risk rule? Is it a regional criteria pollutant rule? The rule, it's kind of changed. We believe the objective here is to have an acceptable health risk in the overburdened communities. Having an acceptable health risk in an overburdened community is not necessarily achieved or incrementally helped through the application of BACT in these cases, because, and again, it's indiscriminate in the way it's drafted. So if I am applying BACT that's designed to mitigate regional ozone, that's fine. Is it furthering the health of the immediately local community? Maybe not. Is it going to reduce ozone in the overall community? It may and it may not, but it's not necessarily in line with what the rule says the rule is there for.
Okay, yeah, that's good. Oh yeah, so you had something you said about the testing Okay, well, that was just a comment. Okay, well, here's a note. I didn't have any process, but so when you talk about, you said you're gonna have process controls instead. You actually then mean that you actually, so instead of having like a air monitoring on the fence line, you would have to have control equipment in your actually process, right?
The word control.
Even though,
may-
even though they might or probably should be also continuous monitoring in a way but of a different type. There could be pressures and flows and other things like that.
Agreed. And if I said process control, let's take a look and see. I was probably speaking more to process monitor. Of course, you're not monitoring anything unless you're controlling it. But a common principle is in recognition that source testing is a snapshot and it's only so frequently, pick your period. In the meantime, the application of process monitoring those parameters that have an impact on the effectiveness of the emission control system gives the operator and the agency that assurance on an ongoing basis that the equipment is working. And again, it's things like we know that, let's take a selective catalytic reduction system, for example. We know that its effectiveness is based upon temperature, the dosing of ammonia, maybe the level of engine operations and things like that. So in the absence of monitoring NOx emissions continuously or testing, or in that interim period when you're not in the middle of a test, managing those operating parameters according to the engineering specifications of that solution, that equipment, helps ensure that compliance.
And you do great records then.
Oh, absolutely. Yeah. So
if I were an inspector, I would immediately come out and ask for the next 3 months of temperature data.
And the way records are kept has a lot to do with the size of the operation. So you might have some processes that are checked on a daily basis on a log, and those records retained. In some cases, though, you might have processes that are actually part of the system's process controller, and you have data logging that shows what those temperatures are on a continuous basis, or what the ammonia flows are, and what the engine operating loads are, and things like that.
Okay, thank you. So now I have Mr. Wade here. I only wrote one word here, the maps. I was kind of curious here. Some of these maps, when you go down into like your maps number 7, I found it interesting that we have now, this is the 80th percentile, and let's see, 2 risk factors. That none of the area in South Valley actually ends up being as part of the.
It is not, it's not included as an overburden. Now, again, when we did this maps, we just looked at the, environmental risk factors. Now, in the rule, there is another component that's added to that. We did not look at that. We wanted to basically look at, once we looked at the 50% and how that affected the whole of Bernalillo County, we did not go any further because adding more to 80% of the county really wasn't going to be any more informative.
Right. So, but if you select different risk factors, the map will change.
Yes.
Oh, well.
I mean, if you
Yes,
went-
it will change. I mean, there's no way you can make one with different risk factors that will look exactly the same. So,
Well, if you look at the proposed rule revised for a lot of these factors, they dropped it from 2+ to 1+. But then they also added some social economic conditions in it that and then instead of ors, they added ends. So if you look at their maps, you're still getting, and they didn't have any statistics on that, but you're still looking like the overburdened community is about 80% of the county. So they did revise some of the definitions and on how you addressed what is an overburdened community. They looked at lowering the number of environmental risk factors, the socioeconomic indicators, and what was the other one? I can't remember now.
health indicators,
The
right?
determinants of health, yeah. So I mean, it changed along as with the newer versions of the proposed rule. This was done based on version 4, which is the one that we were given and developed these maps for.
Okay, yeah, thank you.
I don't know if I answered your question or not, but
The board's going to continue with questioning. I'll just ask the board to find a convenient point to take a break about 5:15 or so. That way we can get a break before public comment. A board member comment?
Thank you. I'll be fast. I only have a couple. Just one for Dr. McMullen, and it's related to Member Richards's question that she asked you about the EJ screen. Just to go with the next step to that question, you had said that that wasn't a reliable way to determine actual health impacts. And then Member Richards was talking about using that as a baseline and adding some local data in. And I was wondering if you knew of any jurisdiction that has created a map like that, or whether we're talking about doing something new.
Yeah, that's a good question. I'm glad I have a chance to maybe clarify. Where I've been most concerned about the use of the EJ screening indicators was with the denial of the permit. That's what I meant by making a regulatory decision with it. I think the initial objective of using it as a screening tool to develop a criteria to identify potentially concerned communities of potential concern is exactly what that tool is intended to be used for. I always think that it gives you some information and then you can dive deep in like the health department available information to go, is there something really here, right? With our actual data at a more granular level would be a next logical step. I still think that that's it's a piece of our public health information, right? Along with environmental data, like monitoring data that may be available, et cetera. But my biggest concern with the rule as it's written now is to use the cancer risk environmental factor that comes from that screening tool and to use the respiratory hazard index number. And then, so it doesn't actually, what's being proposed in that rule, it doesn't directly come from the EJ screen. You get 1 year out of that EJ screen. What Dr. Clark had recommended is that you go back and take 3 years of data and then for some reason average it and then get a mean and then use it. Like it's cancer risk data at a very large level. It's not even rates of cancer. So for that reason, I say a screening tool should be used as a screening tool. It shouldn't be used for permitting like that. And I've never seen that as a comparative group, right? You usually base it on a risk number as a threshold.
I guess I do have a second question.
Sure, you can have as
It's not
many
just
as you
one
need.
question. And I don't know if you feel comfortable answering this, and that's okay, but like, can you envision a map where you would feel comfortable using it as a regulatory tool? And if you can, what would have to be on that map?
Yeah. So so I'm sorry, I'm not explaining it. I
Sorry.
think, no.
I might just
No,
not be
but let's,
understanding.
I want to get it till you get it.
Like I
I
said
do
before,
think
I'm a
it's-
lawyer, not a scientist.
Oh, are
so
you? Oh,
There's
okay. I
some
thought
like, I have some mental blocks about some number of things. Go ahead.
It's all right. Sometimes I do too. Especially this time of day. So I do agree using EJ Screen as a mapping tool is exactly what it's intended for. I do. So I think that's a great idea. I think the EJ Screen as is sufficient, not the criteria proposed in the rule, which is limited to certain factors. It disregards a lot of the social determinants of health. It uses a different threshold than what EPA recommends, but EPA's EJ Screen is an adequate screening tool. And that's what I would consider using as your mapping tool. Does that make sense?
Yeah, it does.
Okay. Do you know what I'm talking about in the last part of that rule that has the criteria? That's that part that's it's odd. I've never seen this before. So I had to try to understand where that was coming from in the rule. It's like, so those two factors come back to that screening tool when you map. So it was a weird, I don't know why those aren't just included in the screening tool as an indicator of potential environmental concerns, which is what it's intended to be done.
Thanks.
Does that help? Did
Yeah,
I finally
it does
get
help.
it? Okay.
Thank you.
All right.
And then I just have a couple of questions for Mr. Wade. I actually have a quick question about your map. Could you, maybe I just missed it, but you reference the dark purple is general manufacturing and the light purple is light manufacturing. What is the difference between those that you're talking about?
Those are. That came from the zoning mapping from the city. Now, unfortunately, it doesn't have any of the county mapping for that's overlaid on this map. This is just the city zoning requirements.
Okay. Do you know, I'm just curious, do you know what kinds of things are in each category? I guess it doesn't really matter. We can skip that. I just didn't know if you were referring to something specific because.
Well, I mean, there is some differences. So like an asphalt plant, you wouldn't consider that light manufacturing. So they have to find specific areas where like a heavy industry or, a general industry or manufacturing or can be placed. So they're limited on where they can go. For like an aggregate facility, that's more of a light manufacturing. So they have a more open, a number of areas that they can locate in.
Okay, thanks. And then we don't have the city here anymore, so I wanted to ask you about the permits that you've prepared since we can't ask them. You said that you had prepared like 50 permits for EHD. Could you estimate how often EHD requires someone seeking a permit to install meaningful emission controls and things like monitoring?
There's always meaningful controls, and a lot of that is driven by the model. So you have you install or you input the maximum operation, maximum emissions. You can do a first cut on the modeling. If the modeling shows that you're in violation, then you start figuring out, why am I violating the ambient standards? And then you can address, okay, it's due to this source. What can I do to that source to lower the emissions? Or if it's overall facility, what do I need to do as far as operation? Maybe I need to lower the amount of material I can process in a day or the number of hours I can operate. And then you go back to the model and you input that information to see, am I now in compliance with the ambient standards? So, I mean, it's an iterative process, but a lot of it is driven, and all of New Mexico is the same way. It's very well driven by the ambient standards.
Okay, and then my last question, still about that. Does EHD come up with all of its required emission controls based on those models, or are they also considering other things?
Does the Environment Department come up with those? Usually those controls are proposed by the applicant.
Okay.
And that's based on, you know, what's available to meet the requirements. For a lot of my facilities, we're talking about, you know, like the asphalt and the aggregate and the concrete. A lot of that is you're moving dirt around. You pick up dirt, you put it in a hopper, it gets conveyed to certain places, gets processed, crushed and screened. So those are all open processes that are going on. So there's a limited amount of controls that you can put on those facilities. Usually it's watering, and that's what the, if you look at AP 42 emission factors, if you water to a significant amount to decrease the visible emissions from a piece of equipment, they predict the emission factor to be this value. And that's what you use when you do your calculations for emissions. There's not, you can't put like a bubble over the facility. I mean, that's just not cost effective.
Often, sorry, I didn't mean to interrupt you.